So we've talked about range of motion. I've talked about active, active assistive, and passive, and what they mean and how they need to be done. And I would suggest that they really need to be performed daily, and it may have an impact on pain. And we know that pain and fatigue are huge problems in this condition. We talked about a little about hydrotherapy and pool exercises. You know, the buoyancy of water, how water can be used as a medium for assistance or resistance exercise, and how the temperature, slightly warm water always feels good to most of us. There might be some people who function better and feel better about exercising in cooler temperatures. Again, depending on the availability in your communities, the why, the community pools, recreation centers, you know, you'll need to see. And the accessibility for those that have difficulty getting in and out of the pool. Is there a walk down ramp or not? So these are all things you'll have to look into when you think about hydrotherapy or pool exercises. And as I mentioned before, is the dressing and dressing and accessibility. That is what I have heard as the main reasons people choose not to get involved in it. We talked about recreational activities, you know, walking, cycling, swimming, dancing, gardening. As I said before, pain is a big problem. Can I have a show of hands how many here have a real problem with pain limiting their function? And is it constant, frequent, occasional? Is it brought on by something you know you did or a part of life? Or
if I sit for a long time, I have a 45-minute drive to and from work. I get like really stiff. I work with kids with autism, so I'm on my feet a lot, and I find myself like compensating to one side more, than like my hips will hurt, and I just can't come home and lay down.
I'm transitioning from aching to actual pain while walking.
Same thing, standing for long periods of time or walking for long periods. So like cooking dinner, I'm done cooking dinner, I'm done. You know, so I'm trying to learn to break it up throughout the day.
you know, one of the things, again, this goes for pain as well as fatigue. You know, have you organized your day and knowing what your capacities are, and if late afternoons you know is going to become a problem, how might you get some rest? And, you know, another thing I notice is chairs like these are not the most helpful. The one on wheels feel unsafe. The other things, like cooking, you know, if you have something high, like a bar stool, that you can sit on, I recommend to a lot of our patients who have difficulty getting up from lower surfaces, is a bar stool-like chair, you know, that's at a slightly higher level, makes getting on and off a lot easier. So for those short bursts of rest, you know, cutting things, that kind of an arrangement, and then getting up. So when you work with a therapist, whether it's a physical therapist, occupational therapist, or other rehab professionals, even these simple devices that you might be that they might be able to recommend, depending on your lifestyle and your needs, become very important. So please keep that in mind too. We know that pain is a huge issue. The most common sites, as would be expected, are the shoulder girdle region, the low back, and the low back. It is very common because think about it. You know, you have abdominal weakness. To maintain the body in the correct posture, we need strong muscles in the front and we need strong muscles in the back. So if the strong muscles, like if the muscles in the front are not doing their job, then it's the muscles in the back that are taking the brunt of maintaining the posture for us and helping us stand and function. So they get overused and they get tired. And their way of telling us is, hey, I'm hurting. It's pain. So we really need to try and learn to listen to our bodies and the signals that our body is sending us, okay? And see how we can minimize some of those symptoms and again build it into our lives. 10 minutes of rest, 10 minutes of sitting down, 10 minutes of moderate activity. It's like a puzzle, but you are the best person who can decide on any given day how those pieces need to come together. I cannot tell you that you will do this, this, and this every single day. Okay, I leave it up to you. We are a team and we work together in how we achieve our common goals. Some people have found abdominal supports, corset-like devices to help the low back pain. So that's something you may want to try out. When you first try these things out, you will find, though, that your body has adapted to its weaknesses and has found a certain way of doing things. And when you put something new on it, it changes the whole body mechanics, and it'll feel strange to walk. So again, it's a matter of adaptation and experimentation and slowly trying things out. You may only try it out in sitting in the beginning, and then gradually maybe more. But again, that's something you may want to think about. Fatigue is a big issue, and fatigue is common as people age or the impairment, weakness progresses. And again, energy conservation strategies will become important. And some studies have shown that actually aerobic exercises seem to help decrease fatigue, which seems counterintuitive sometimes, but actually may be helpful and may increase your ability to do more as you pursue the aerobic exercises. And your body sets a different sort of norm for itself. So, as I said before, individualized plans are very, very important. And how do we make decisions about these individualized plans? What do we take? What are the factors that will help determine things? One obviously is the age. Is it a young person, older person? Because the activities that a young person may like to do or want to do may not be the kinds of things that someone else a different age wants to do. So right there, we need to find things that someone is interested in, that we know that they will stay with, they want to do, and work with them using those as a means to exercise. Clinical profile. People might have the exact same deletion, the length of deletion, and yet show a very different clinical profile. So we can't go by saying, oh, you have this sort of a thing, this works for everyone with that. So we really need to look at your current clinical profile. And then the personal profile. Are you working? What kind of a job do you have? Someone that sits at a desk versus someone, who's in the landscaping business, as we heard before, have very different needs. What's your role in the family? Do you have an 18-month-old infant that you're running around with? What are your interests? What is your financial, environmental, and social situation? What are the barriers and facilitators that we're talking about here? And how do we deal with those in coming up with a plan that works for you? So this is why individual recommendations become so important. And I cannot say that, this is the recipe or for this kind of a cake. This is not one plan fits all. And this is why it has to be individual.